Okay, thank you, Ju. Many thanks to the AIDS conference to provide me this opportunity to share our study here. My name is Zhang Xudong. I'm going to talk about the sexual and reproductive health in adolescent female sex workers in Kunming, China. Preventing adolescent pregnancy and the increasing use of modern contraception is an important public health strategy and also key to address other global development priorities, such as poverty reduction and the gender equality. However, the restriction on access to sexual and reproductive health services remain. For example, governmental funded family planning services accessible only for married couples, and the social and cultural taboos towards premarital sex, and also the stigma and the discrimination and the criminalization towards the sex work. Recent years, studies noted an increasing number of young female sex workers, particularly in large cities of China. These girls, they are facing dual stigma. Firstly, they are sexually active unmarried youth. The second, they are engaged in sex work. However, they have been given the least attention in existing research and also the programmatic delivery. In 2012, we conducted this research in adolescent female sex workers in Kunming, China, to increase our knowledge of unique sexual and reproductive health challenges they faced. There were three specific objectives for this study. The first, to describe use of contraception and sexual and reproductive health services. The second, to assess family planning and reproductive health knowledge level. And the third, to determine the factors associated with unmet need for modern contraception. This study was a cross-sectional design by using a two-stage cluster sampling method. And our study population was girls less than 20 years of age and self-reported to sell or exchange sex for goods or money in the past 6 months. And here is the map of our study site, Kunming City, which is the largest economic center and the capital of Yunnan province, located in southwest of China, and also bordered Myanmar, Laos, and Vietnam. The major findings we presented here are adolescent female sex workers' vulnerability to sexual and reproductive health, including HIV. But some of them are also important to the general adolescent population. Our findings show the majority of adolescent female sex workers, they are rural to urban migrants with lower education level and the higher economic pressure. And the traditional protective factors, the school and the family, were withdrawn for these young girls already. Our findings show a high prevalence of unintended pregnancy and multiple pregnancies and abortion among adolescent female sex workers. For these prevalent rates, they are much higher than other sexually active adolescents in China. And moreover, in the past 12 months, about half of participants had self-reported symptoms of STI. And also, 40% of participants experienced physical and sexual violence from their sexual partners. Although the majority of the adolescent female sex workers in our study currently wanting to avoid pregnancy, but our findings show significantly low levels on the long rates on the consistent condom use and the dual protective method use, as well as the long-acting reversible contraceptives use. Moreover, there were 35% participants had unmet need for modern contraception. And we find that the unmet need for modern contraception was associated with having current non-paying partner and the frequent alcohol use, and also the lower sexual and reproductive health scores. In conclusion, the high level of unmet need for modern contraception and the high prevalence of unintended pregnancy and abortion, and the low level of sexual and reproductive health knowledge demonstrate an urgent need for comprehensive sexual and reproductive health services for adolescent female sex workers in China. Early and urgent legal and policy response to facilitate the universal and equitable access for these criminalized and vulnerable girls is the key to ensure their health rights and also secure their future. And this slide brings me to the end of my presentation. For the support to this study, we would like to thank the local female sex workers organizations in Kunming and the district level of Centers for Disease Control in Kunming, and the Burnett Institute in Australia, as well as the International Center for Reproductive Health of Ghent University, Belgium. The most importantly, we would like to appreciate all of our study participants. And thank you for all of you for your listening.